I'm a year and a month past my surgery. It really hit me this year about how thankful I am feeling about having, health. So it's amazing. It's really a miracle. And I started seeing stronger performances that I haven't seen in 6 years. A year before, so this was just prior to my surgery, I had to go sit down and the paramedics came out to check on me because I looked horrible. I felt horrible. And a year later, I was standing there happy. Every day we have is a gift.
Welcome to Imperfect Heart, a place for you to join me, Jeff Holden, in conversations, discussions, and dialogue about our hearts and the impact myocardial bridges have on them. We'll talk with healthcare professionals, those in related fields that support our condition, and others just like us with stories of their myocardial bridge experiences. It's my intention for this content to inform, educate, entertain, and even motivate or inspire you in your personal journey on dealing with a myocardial bridge. Most importantly is to have you leave each episode with hope, knowing you're not alone and that what you're experiencing is real. Just a quick reminder before we get started that the book is now available at Amazon.com, Imperfect Heart, Stories of Myocardial Bridges. Buy it for anybody who doubts that this condition is symptomatic. When I first sat down with Pete Furman, an avid cyclist, back in 2023 for one of our Journeys episodes, he'd just been diagnosed with a myocardial bridge. Drug therapy had failed him, insurance was getting in the way of the care he wanted, and his health was sliding fast. If you've heard episode 36 or saw us on YouTube, you know that conversation ended in a place of uncertainty. Big decisions ahead, no guarantees. And that's where we left it. Until now. In this follow-up, we pick that story up on the other side of some enormous crossroads. Pete walks us through what happened after Blue Cross Blue Shield denied his preferred choice of surgeons, how he leaned into self-advocacy, and how he ultimately found a local cardiac surgeon who was willing to learn, listen, and fully commit to unroofing his myocardial bridge. We talk about navigating insurance, asking hard questions, extracting clear promises, and making peace with an open-heart sternotomy when the clock is ticking and your symptoms are getting worse by the day. And this isn't just a surgery story. It's a recovery story. Pete shares the emotional reality of recording a just-in-case message for his wife, the fear of not knowing how it would all turn out, and then the unexpected twist, discovering that part of what was holding him back after surgery wasn't his heart, but how he was breathing. With the help of an athletic-focused cardiologist and a simple breathing device, he's now seeing performance on the bike he hasn't seen in 6 years and is training with an eye toward racing again in 2026. If you're wrestling with insurance barriers, wondering whether you can trust a local surgeon, or afraid you'll never get your life back after a myocardial bridge diagnosis, this conversation is for you. Pete's story is proof that you can still find the right help, sometimes closer than you think, and that showing up for your own life, even imperfectly, can change everything. Pete Furman, welcome back to Imperfect Heart.
Thanks, Jeff. It's an honor to be back and a privilege. The work that you do with our community is amazing, and the fact that you've asked me to come back on again to update my story is a real gift, so thank you.
For those who haven't listened to episode 36 on the audio side or on YouTube by searching Pete Furman, when we spoke the first time, you were in a real rough spot. Walk us through briefly what was going on. Just give us a recap.
Yeah, thanks, Jeff. July in 2023 was my first trip to the hospital with heart problems. 2 years prior, I was noticing issues, but July in 2023 was my first trip to the hospital, and I shared in our last talk that I was one of the lucky ones. I was diagnosed with a myocardial bridge in that first trip to the hospital. And so I began the year of drug therapy that was a horrible experience, didn't do anything good, just got worse. And then July 2024, I had we're going to call it a significant ischemia event. We don't want to call it a heart attack because none of us want to think about that. But in retrospect, now it appears that it didn't do any permanent damage. There was some lasting ischemia in my septal wall, but I appeared to come out of that okay. So after that event in July, October, well, I think you and I talked on, I made a note here. We talked August 28th. So I was a couple weeks away from meeting my proposed surgeon and 2 months away from my heart surgery, which was October 18th of 2024. So it's just a year and a month now since my surgery.
And you went through a variety of iterations. You spoke with the people from Stanford and Schnitger. And what was the outcome?
Yeah, I mean, talked to Kofidis, I talked to Shaw, I talked to Schnitger, I talked to Guy and Henry. And, after my ischemic event in July of 2023, they all decided that surgery was needed for me. My myocardial bridge was significant enough that, and I did respond to the drug surgery. So we needed the surgery, and I scheduled it with Dr. Guy because I was interested in the robotic surgery. And we got it scheduled and we went through the approval process, and Blue Cross Blue Shield denied it. And they proposed that I see a local down in Phoenix cardiac surgeon. And you and I spoke, and I was 2 weeks in front of meeting with him for the first time.
You took a really interesting route, because when we had that conversation, you said, hey, I'm under the belief from a few of the doctors that you've spoken with that if somebody does a fair number of bypass surgeries, they probably have encountered some semblance of bridging to the LAD in order to do the bypass. And the suggestion was, if you have to do this on your own and you can't find a surgeon that is familiar or has done several of the unroofing procedures, that find a guy or a gal or a woman or a doctor who does the bypass surgeries, who's done a good number of those, because they will have experienced something. And I think that's what you did, yes?
Yeah, it kind of like that. I would say that maybe bypass isn't enough. Speaking to Shaw and to Guy and people, I have, and I'm still in the belief that surgery itself is not technically that complicated. And a cardiac surgeon that's doing the valve replacements and the heart transplants. So it's more than just the bypasses. I think when I was initially diagnosed, they were going in there to think about a stent, and the cardiologist, of course, he's an interventionalist, not a surgeon. And he saw the bridge and decided not to stent. He knew that much and said, you got to find a specialist. But I think a very good, broadly experienced cardiac surgeon can do this work.
So you found your local in-system, acceptable for insurance cardiologist, and it wasn't just a meeting you had with him. As I recall, you walked him through every step of the way in detail with documentation and information. I think you shared some of the podcasts where we've got some detail from the doctors. Tell us a little bit about what you did for the benefit of others who will have to go to the same route.
Yeah, so it was Blue Cross Blue Shield that suggested this person, and I reached out to his office and scheduled a consult. And that's when, you and I spoke, and then 2 weeks later I went down for the consult. So before going down there, I emailed him or sent into his system links to some of the technical articles from the website, from the myocardialbridge.net website. Those resources that are in there are great resources, and everyone should read every one of those articles. They're really amazing resources. But I think I picked 2 of them and I sent those down to him. And then my wife and I showed up in his office. And I'll tell you what, Jeff, I really lucked out. This guy was confident, but humble. He had a sense of humor, but he was serious. He saw that I had my list of questions. He'd said he read those articles that I sent him. And he said, hey, this is your meeting. Why don't you ask your questions? And so I rattled through my list of questions with him, and he answered everyone in detail, with humor, but then when it wasn't appropriate, not. When Lisa asked him a question, he looked at her and talked to her. And I just got it was like the best doctor consult visit. And I think we spent an hour together. He didn't express time pressure with us. And he just did a tremendous job. My questions were all about, how are you going to go in there? We need to fully unroof the bridges. What does that mean to you? And how are you going to start this thing? Stanford has a very specific approach for locating the bridges. What are you going to do? His approach was very much like Dr. Guy's. He wanted to start at the apex of my heart, which is the bottom tip, find the LED at its lowest branch, and then trace it all the way back up my heart, he said. And he would unroof any bridge that he saw. And I talked about fully unroofing. What did that mean to him? And he said he understood that if it was deep and there was a risk of the tissue rejoining above the bridge, he would stitch it back, just like Dr. Guy does as well. And okay, and then I asked him to commit to looking for other bridges. And he, would you look at all the other arteries, including on the other side of my heart? And he said he would do that. He wanted to do open heart. We talked about that. His practice does robotic, but he doesn't. But he said, Pete, we've committed to enough things here of me fully unroofing you and examining your heart top to bottom. And on the other side, he said, I want to do it open heart. And that was his special approach, his preferred approach anyhow. So, so we agreed to that. We set a date for surgery, but then I told him there were more hoops we had to jump. My surgery was on a Friday, and I told him that I wanted to come in the days before just to review everything. And his office first said, well, we really don't do that. And I said, it's important to me. And then he agreed to do it. And so I went in on a Tuesday, and we went over the same promises. And I had a couple more. I wanted to talk about the pericardium, whether he was going to stitch it back closed or not. And we talked about we left it open. That was his preference. And then I also wanted to ask about the thymus. Is it called the thymus? It's a gland that's right in front of the heart. And when infants have heart surgery, they destroy the thymus. The thymus is the center of one of the key elements of your immune system. So I wanted to make sure he wasn't going to touch the thymus too. I've never heard that talked amongst our group before, but he assured me that in adults, the thymus is small relative to the heart and it's just not an issue. So yeah, so we did that. And then the day before surgery, of course, I'm checking into the hospital and doing all those tests. And I asked everybody what they thought of Dr. Cologne. And I got amazing reports. And so the day of surgery, I was confident that I was going to pull the trigger if I saw anyone raise their eyes or do anything. But everyone gave me the right data, and I went in the day of surgery confident that he was going to do a great job.
And for the benefit of those who didn't listen to the earlier episode, you're an engineer by trade. So I am not surprised at the detail, the attention to detail, the follow-up, the more attention to detail, and the more questions. I've not even heard of the thymus. Yeah. In any of the conversations, nobody's ever mentioned it.
No. Yeah. I have a granddaughter who had a hole between her heart chambers. And so my daughter, having grown up in a household with that influence, she did a bunch of research and was able to figure out how my granddaughter's heart could get fixed without destroying the thymus. So if it was a piece of knowledge that I had coming into this, then yeah.
So for the benefit of people who are, again, listening to this for the first time, my next question was, what about the anxiety? I think you just answered all that. And yes, there's a tremendous amount of anxiety. How about your wife and your family? How are they dealing with all this, knowing you're going to, a doctor locally?
Yeah, that's a great question. And, Lisa was on the phone calls with me with Cofidis, and she went to Stanford with me to Schnitker, and she went to Georgia with me to see Dr. Henry. And so we had been talking, and Dr. Shaw, she was online. We were talking to Dr. Shaw too. So she was there present with all these experts. And we go down to Phoenix together and talk to Dr. Cologne, and we both came away with that feeling of he's the right guy. But I'll tell you, Jeff, one thing I'll share, it was high anxiety, and my health was actually failing quite rapidly. Even after our phone call, I went down the tubes in a big way. I mean, I couldn't even walk around the block anymore. Lisa had to hold my arm everywhere we went. I ended up so short of breath. It was crazy. Of course, Lisa and I are both engineers. And so we always have done planning, in the eventuality of, but she came to me a week before the surgery and said that, our affairs are in order. And, we have lots of photographs of everything. But she said, I don't have a recording of your voice anywhere. So I tried to figure out how to record a little story for her before we went down to Phoenix for the surgery. And it was the hardest thing I've ever done, not wanting to say goodbye, not wanting to make the video, their voice recording about being gone, but, just, hey, this is something that we do every day. Let's share my thoughts about something. Boy, it was really hard, but yeah, the anxiety was really, really high. It's a serious surgery that you go through, and the rapidity of my declining health was really scary.
I'll add to the point of that voice recording, not so much that my wife hadn't had some voice recordings. Obviously, I do a lot of stuff, but the thing that I wanted to do for her was a special series of songs for Christmas, because my surgery was on January 4th. So I'm in the studio and I'm recording these songs and putting this montage together with some of my commentary in between. Again, because we don't know what the outcome is going to be. And it was one of the hardest things I've ever done to date. I still could get weepy over it. And I was a mess doing it. And then when I played it back to myself, I was a bigger mess, just
exactly.
thinking, she's going to have to listen to this if this happens. This will be brutal. And then part of me was like, okay, well, that's good. I want, to really feel the emotion in it, but it is tough. It's really tough. Did you have any blockage? Was everything else good? Any calcium calcified plaque or anything like that?
I do have, what do we scored at? 40 or 50% blockage proximal to the bridge that we haven't done anything about yet. I just found a new local cardiologist. I think my first appointment with him is going to be halfway through next year or something like that. And I'm going to ask him about what kind of follow-up we should do about that at this point, but I haven't. One of the other things I wanted to say in my story was, when I was extracting all my promises from Dr. Cologne, I said that I wanted pictures. And then after the surgery, the day after the surgery, when I was talking to him, he had said he gave me the pictures, which actually was video. And I must tell you, I have a video clips on my phone of my chest splayed open and his hands on my heart, not beating. And I'm able to watch it. It's the most mind-blowing thing I can imagine, looking at my heart not beating. But one of the things he shared with me in the post-surgery was that I had a kink in that bridge segment of my LAD. And it was oriented such that that segment was getting squeezed like an accordion. And if we hadn't unbridged it, it was going to get me. Yep. So.
Yeah, that's not the first time I've heard of that kink being significant and a potential cause of sudden cardiac death. Well, that's wonderful that he got that out of there. So here we are on the other side. Obviously, things went well because I'm speaking with you. And a little bit over a year ago.
Yep.
Tell us how things are going today, Pete.
Well, things are going great. I had some initial difficulties. I was back in the hospital 2 days after my surgery, I think, with, is it a blood clot or is it not? Really sharp pain stuff. But it all cleared. And I played game with the protocols of, not driving and not exercising, letting the sternotomy heal. Then I started being super enthusiastic about getting on my bike. And Jeff, you know, I feel super fortunate that I'm able even to walk around the block, and to get on the bike was a gift. And I started riding hard again, but I felt that my recovery wasn't going very well. And I had echoes of the early discomfort, strange feeling, heart rate wasn't right, breathing wasn't right, still having a little bit of the jaw pain, which was my number one reliable symptom that, you know, a vasospasm could be coming on really big. And I just wasn't sure what to do about it. And Dr. Cologne, bless his heart, you know, he's told me, I'm the plumber. You're fixed. You need to find someone that can help you with these things. And I was able to find a athletic oriented specialty cardiologist down at Mayo in Scottsdale, Dr. Reddy. He initially declined seeing me, but then my primary care doc wrote him a nice note and he agreed to see me. Put me through a battery of tests again. I got another echocardiogram, and then he wanted me to do a cardiopulmonary evaluation to see how things were going. And he, after all that work, he discovered that I wasn't breathing correctly. I wasn't using my chest muscles to breathe anymore. I think that, you know, my brain and my heart, my lungs had all conspired to just take it easy, and I forgot how to use these chest muscles. So he gave me a little breathing device, and I figured out how to breathe again. And I've had now athletic performances that I haven't seen in 6 years. And so I'm doing amazing. You know, it's been such a blessing and such a great thing to get on the bike and exercise, and that I'm overdoing it. And I've got tendonitis in an elbow, and I messed up a wrist, and my back was hurting me, but I'm even kind of past those things now. And I'm starting to train with the hope to actually get on my bike and race again in 2026.
And for you, train and riding and racing is serious. You competed in the senior games pre-COVID, correct?
Yeah, pre-COVID, you know, I qualified for the U.S. Nationals 3 times. So it's every other year. So I was winning the California State Championship, and I won the Arizona State Championship. And I was, hoping to podium at U.S. Nationals.
And you feel well enough at this point in time to begin the training process again, knowing what that involves, that you could never have imagined just a little over a year ago.
Oh, I wouldn't have ever thought that I could do it. And my goal for return to racing is, if I just pin numbers on and I participate in a race, I'm going to be goal achieved. You know, I also did have a couple of good friends pass away through this period. And so I'm riding in honor of them. I've got my black band prepared, and I want to ride in their honor. But yeah, just showing up to a race is going to be a victory.
I couldn't concur more. I absolutely, totally agree. Just showing up, just being able to do it is the blessing we've been given as a result of the surgery. You know, you held up that device. Hold that thing up again, because for those who are watching on the YouTube channel, they can see what it looks like. Does it have a name, or what's it called?
It does. It's called the breather, and there's different versions of it. This is the fit one. It's the hardest to pull air through. It's got adjustable inhale and exhale pressure settings, so you can really restrict it and really train yourself to breathe deeply. Yeah. It's a beautiful device.
And is it something that you do in perpetuity, or is it just over a period of time until you get that capacity and proper process of breathing back?
Yeah, I think Dr. Reddy really believed, for me, I just had to retrain my brain to use those muscles in my chest. And so once I activated them, I'm good. I checked it just the other day, and I had it on the hardest setting, and I was still able to do my repetitions. So I think it's holding. I think it's working.
Because I'm thinking of some of the other interviews that we've done. There's people who have had this struggle with still shortness of breath. And I'm wondering if, in fact, it might not be just an understanding of how to breathe properly as opposed to, oh gosh, it's my heart. Because in many cases, they've been unroofed properly. And that may be the issue they've got. So hopefully this will help them understand or future unroofed patients
Yeah.
realize, okay, I need to do this. And I know the spirometer is so significant coming out of the surgery, but it's not so much about the ability to learn how to breathe again or to breathe properly. It's just to make sure that you stay clear and don't get any
Yeah.
fluid buildup.
Yeah. There's there's less aggressive forms of this device that you can buy, all called the breather. But it's a significant step up from the spirometer. This really is work to
Yeah,
use.
yeah. I thought initially the spirometer was work. It was, oh my
Yes.
gosh, you want me to do what? This is hard. Just coming out for the sternotomy and the chest not wanting to do its thing. And you're not sure if everything you're doing is right and questioning it all. So, Pete, you're active on the Facebook site. You've been extremely supportive for a lot of people who have either been in the position you are or post surgery, pre and post. What would you say to somebody who's just beginning their journey and they're finding themselves in that same gridlock that you were not too long ago?
Yeah, there's a lot of people that tell their entry story in our Facebook site, and it's amazing. And people like Rob and Jen, and there's countless others that respond and answer questions, and it's a beautiful thing. It's really a support community. I really recommend that people go to the website too and digest the resources, watch your podcast, to hear those, to watch the doctors speak that we have. And, they can answer so many questions. But to use the Facebook site, for me, using the Facebook site, I posted post my surgery and in my recovery. And the responses you get are just amazing, encouraging, heartwarming. People, there's a bunch of us out there now that have gone through this and are in your corner. And, whether it's giving the thumbs up or actually posting something in response, we're all out there rooting for you, and use the resources.
We talk about self advocacy so often, and dismissal is the opposite. You have to push through. You know something's wrong. You understand your body better than anybody else. How would you address that relative to the insurance process? Because it can be daunting and overwhelming in many cases, yet you were able to navigate through it. You ended up acquiescing, I know, but you went through a variety of different approaches to get to what you originally wanted to do. How did some of that work? Let's just touch on it a bit.
Yeah. I'm not really sure how it worked in the end. I fought a big battle, and, you do all the reading, you do the research, you find the gap coverage agreements, you read the details of your plan. And I can't tell you, Jeff, maybe Blue Cross Blue Shield knew that this surgeon that they found for me. And let me just mention again, when I met with him, he had said that in the course of his surgeries, he had fixed about a half a dozen or maybe a little bit more bridges in his time. But he had never intentionally gone into someone's chest with the objective to fix a bridge. So I was his first patient in that regard. But clearly, he was a very skilled surgeon. And whether Blue Cross Blue Shield and their administrators somewhere knew that he was going to be capable of it, I don't know. But I ended up capitulating because I had to get it done, or it just wasn't going to be good news. I still think those mechanisms are in place. I only went through one of the 3 appeal levels. When I was denied Dr. Guy, we appealed it. Was denied again. And that's when I decided to go ahead and meet with this Dr. Clone, and it worked out. So I didn't have to do more. But there are 2 other appeal levels that I could have tried for. And I just don't know how it would have worked out. There's definitely words in there in the agreements about centers of excellence, and right. They word these documents that they want to care for you, with a certain degree of professionalism. And I think that if you really don't have resources, I have to believe that there's a way you can get to it, but it's going to take a lot of energy. I put in a lot of energy in it, and I still capitulated in the end, but it worked out for me. So,
And it did. And that's the encouragement I want to give to people who are listening. Just because you can't get your first choice or your second choice or get what you want the way you want it, it doesn't mean it's a fait accompli that nothing's going to happen. You can find it in your backyard. I mean, we recently had a conversation with a doctor at Lake Havasu. It's in Arizona, a tiny little spot, who's doing unroofing procedures. And post that conversation, he sent me 2 emails already saying, this is kind of crazy. I've already seen 2 people having nothing to do with the episode. He's gotten certainly calls and interest from the episode, but these 2 people just came through organically. And so they're there. They're out there. They're experienced. They've seen this condition. To your point, they just haven't intentionally been going in for the procedure, and then they identify it once they get in there, and naturally they understand it and they take care of it to the best of their degree. Now, yours, I think, got the benefit of a much more in-depth conversation with detail and procedure. And anybody that's listening certainly is familiar with that. They have access to all those tools to take to the cardiologist or the cardiothoracic surgeon they're going to use. So please do that. If it all seems like you can't get to where you need to go or want to go, but you have an option that your insurance will cover, use it.
Yeah, Jeff, I really believe that this is a doable surgery, but challenge your surgeon to see if they're the kind of person that will do the little bit of reading that they have to do to understand what fully unroofing means and what chasing all the potential bridges mean. And if they do that and they speak to you about it, and they've done fairly complex heart surgeries, I think it will turn out okay. It really will turn out okay. And we spend a lot of time on the Facebook group and stuff. And, bless everyone is doing that work about sternotomies versus robotic assist thoracotomies and all the rest. And I still think that when you find a surgeon that you finally believe in, go with whatever their preferred approach is. If they're a sternotomy person, sternotomies happen every day, hundreds, maybe thousands of times a day in the United States. You can recover from that. You really can. So, whatever the resource you find, it can work.
And there is an episode with Dr. Barry of Stanford about the sternotomy. Interestingly enough, it's one of the most popular episodes, and it's because so many people have it done. It's, searched and found way beyond the myocardial bridge group. But he even says people fear the sternotomy so much more than they fear the actual surgery itself of the heart surgery.
Yeah.
Just the irony, because they can see it and they hear so much about it. And today, the sternotomy has become such a simple process, not without risk, but they really understand it well and they know how to put it back together. And the pain isn't as great as one might assume. And the misnomer is cracking the chest open. They don't crack anything. They very surgically go in, do it, and put it back together. So for those who don't have the option, but they wanted robotic and they have to do the sternotomy, it's fine. For the most part, it's fine. And I appreciate you saying that too, because here you are, here I am. It was uncomfortable for a while. It takes a little longer to heal, yes. But nonetheless, it's a few weeks, maybe a month out of a lifetime where that discomfort is of any significance, and it's over. And we forget about it.
The other element that I had struggled with prior to surgery was, as to how's the recovery from the sternotomy going to be. But I also didn't want to wake up in recovery still being intubated. And I talked to my surgeon about that. Saw my dad struggle with being intubated at the end of his life and still with me. And so I told him that I was very sensitive to that. Well, I apparently had some trouble breathing post-surgery. And so I woke up in the recovery room still being intubated. And even that, getting extubated in the ICU, it still was okay.
Mm-hmm. Just a short, funny story. I came out intubated as well. I don't remember anything. And my wife said, "Oh my gosh, I cannot believe you don't remember that." And I was like, for whatever reason, either drugs, who knows? I do not remember being extubated at all, other than a sore throat after the fact. And, fortunately for me, I guess, because I hear some of the stories of, the sensation, the feeling and all that, but I don't want to get into that. That's another whole nother conversation.
Yep.
Pete, I love your story for so many reasons. You took control of a situation, and a lot of those usual assumptions, you threw them out the window, and you said, I got to get this done. I'm not sure I'm going to make it, medically, financially, even the follow-up when it didn't go your way. We said, no, this is not good enough. 90% isn't good enough. I want to get back all the way because I think I can. And that's one of us. That's an imperfect hearter. That's somebody saying, I can do this. And it's because you did that you're where you are today. And it's just a beautiful story that continues to get better with time. And as more and more people hear it, they're going to recognize, I can do this too. And the opportunity is there for them. The resources are there for them. And we're finding more and more cardiologists and cardiothoracic surgeons willing to take the steps. And they're out there. So for the benefit of those who are concerned, you can do this. And as far as I'm concerned, I'm looking forward to a ride with you, whether I get to Sedona or I find you when you come out to California for a race somewhere along the line. My wife wants to get to Sedona, and I would love to ride that area. What a beautiful area it is, with an experienced guide who I know who it will be.
Well, I absolutely would treasure that and look forward to it. And we will make it happen in 2026.
So for the second time around, Pete, thank you from the bottom of my imperfect heart. Thank you.
Thank you for listening to Imperfect Heart. It's my hope that this information helped in some way to improve your situation or will help you better understand this condition. More importantly, that it gives you hope through stories that there is help and you most certainly are not alone. If you've been diagnosed with a myocardial bridge, please be sure to join the private Facebook group, Myocardial Bridge Support Group. For more information about our program or to reach me directly, visit the website, myimperfectheart.com. If you like what you heard today, please give a positive review, thumbs up, high five, or whatever your app likes. And be sure to share with everyone important to you so they understand what it is you're dealing with. Please subscribe as well. Welcome each day with gratitude and positivity. The views and opinions expressed in this program are solely those of the host and the guest and are not intended to provide, nor are they a suitable substitute for, professional care by a doctor, therapist, mental health professional, or other qualified medical professional. Imperfect Heart is a production of Hear Me Now Studio.